Autism Spectrum Disorder typically appears during the early years of life. Early assessment and intervention are crucial to a child's long-term success. Some early warning signs include no social smiling by 6 months to no two-word phrases by 24 months, poor eye contact, not showing items or sharing interests, unusual attachment to one particular toy or object, not responding to sounds, voices, or name. According to the DSM-5, there are some excesses or deficits in children with autism in 3 main domains. Number 1, social. Number 2, verbal and non-verbal communication. And number 3, behavior and interests. Some children may display deficits in social-emotional reciprocity. They may display abnormal social approach and failure of normal back-and-forth conversation, reduced sharing of interest, or even a total lack of initiation of social interaction. They may also find it difficult in developing and maintaining relationships, ranging from difficulties adjusting behavior to suit different social situations to an apparent absence of interest in people. As for the deficits in communicative behavior, you may notice unnatural eye contact and body language, deficits in understanding and use of non-verbal communication to a total lack of facial expressions or gestures. Lastly, for behavior and interest impairment, one may notice repetitive speech, motor movements, and/or use of object. There may also be excessive fixation to routines and strong attachment or preoccupation with unusual objects and activities, ritualized patterns of verbal or non-verbal behavior, or excessive resistance to change. Some children may also be hyper or hyporeactive to sensory input or unusual interest in sensory aspects of environment, such as indifference to pain, heat or cold, adverse response to specific sounds or textures, fascination with lights or spinning objects, and so on. As stated in DSM-5, symptoms together limit and impair everyday function.